What's up, y'all? Welcome back to the BirthFit podcast. I'm Dr. Lindsay Matthews, Can 2, and this is episode number 256. I realized I did not introduce myself in the last episode, even though I reintroduced BirthFit. So here I am, Dr. Lindsay Matthews, Can 2. Can 2 is my married name, Matthews is my maiden name. And yeah, here I am. I am almost 43 years old. I am a wife, a mother. I'm on a pause from actually practicing chiropractic, and I am full throttle in BirthFit. So here we are. Today's episode is called What Happens When Hospitals Choose Mothers Over Money? We're going to get into when leadership meets physiology and how one hospital drops C-section rates by 15% in 5 years. So yeah, this is really cool. This is just an example of how one leadership is really freaking powerful. And yeah, what happens when you remove financial incentives? So, and actually give women time to labor. Huh, go figure. Rochester General Hospital, New York, just proved, and so this happened last year, 2025. What we've known all along, right? Like if you're listening to this and you've been part of the BirthFit community for a while, you've probably known this, that when the system aligns with physiology instead of profit, outcomes transform. So between 2019 and 2024, Rochester General Hospital reduced their C-section rate for low-risk first-time mothers from 40% to roughly 25%. Y'all, that is a 15-point drop in less than like 5 years, one of the steepest declines reported nationally. And 40%, let me just touch on this 40%. There are states in the United States that are pushing, like their C-section rates are pushing 40%. C-section rates need to be around 10 to 15%. That is what the World Health Organization deems appropriate in order for us literally to not naturally select against ourselves. And we won't go into that. But this 15-point drop that Rochester General Hospital in New York, out of all places, y'all, New York is a very challenging place to give birth, just by the way. This isn't a small tweak. This is a systemic change driven by leadership that actually chose mothers over money, or at least chose a different way. And it should give every single one of us, coaches, practitioners, and mothers, hope. So, what actually changed? Rochester General didn't implement one magic intervention. They redesigned the entire system around what works for the female body. So, what did they do? First, they removed financial incentives for C-sections. Physicians no longer earn more money for performing surgery than for supporting vaginal births. And they also stopped penalizing doctors financially if another clinician finishes a vaginal delivery that they started. So, translation, money stopped dictating birth outcomes. That's huge. Number two, they shifted to midwife-led care. Now, like I said, if you've been with us for a while, you know that a lot of other countries are midwife-led, midwifery-led. They're low risk mamas all go midwifery care first. So they shifted to midwife-led care. More low-risk first-time mothers were moved into midwife-led care instead of defaulting to physician-managed deliveries. Nurses and staff were trained in non-surgical support techniques. Think positioning, mobility, and patience. They honored the midwifery care model, not sick care, not pregnancy or birth as a pathology. And number three, they gave women time. Instead of declaring labor failed prematurely, they allowed longer evidence-based labor timelines for first-time mothers. They educated patients on normal labor length, the risk and the benefits of C-sections, and when surgery is truly necessary. You mean they trusted the process a little more? They trusted women's bodies a little more? Yeah. So, y'all, those are three big things in less than 5 years. So, I guarantee that took some big re educating of the hospital staff and those that work in the hospital. So, why does this matter for sovereign birth? This is a validation for everything the mother-led birth movement has been saying for decades. And if you listen to the previous episode I did, you know that sovereign means mother-led. I use those interchangeably. When you remove the systemic pressures like financial incentives, time constraints, fear-based protocols, and you actually replace them with patient-centered, midwife-led, physiologically aligned care, the female body does what it was designed to do. Weird how that works out. So, like I said, Rochester's General's earlier 40% C-section rate was well above federal recommendations, and miles away from the World Health Organization. At 25%, so they're now at 25%, they're now closer to national quality targets. Mid 20% is like national quality targets, which I'd argue, but whatever. I don't know if y'all can hear that background noise, but reminder, I'm sitting in a hotel room right now getting work done. All right. But yes, y'all, I still think that mid 20% is higher than it should be. And that's because even with these changes, I do feel like something was missing. And I bet you can guess where I'm going with this. The missing piece, BirthFit. BirthFit's lifestyle practices as the 7 pillars. What if we didn't wait until a woman was in labor to support her nervous system, her strength, her confidence, her community? What if we started the moment she found out she was pregnant? What if we encouraged her to take ownership of her health prior to conception, y'all? What? What if we embraced lifestyle modifications rooted in the BirthFit pillars from conception onward, right? The sun, circadian alignment, and natural light exposure to regulate hormones, sleep, and mood throughout pregnancy. Quality sleep. Think deep restorative rest that actually supports fetal development and nervous system regulation and the massive metabolic demands of a growing human. Think strength work, fitness, conservative, intentional movement that builds confidence, prepares the body for labor, and supports postpartum recovery. Excuse me. Think nourishment, whole foods, adequate protein, nutrient dense to fuel both mother and baby, and no restrictive diets or fear-based eating. Mindset, nervous system work again, breath work, mental preparation, the shifts a woman from fear to trust, from passive patient to empowered mother. Community, this is the village, the people who hold space, ask the right questions, and remind her she is capable. And what if this woman was actually connected to something bigger, her God, her purpose, the sacred transition into motherhood? You absolutely need God. These pillars aren't nice to haves, they are the foundation. And that is absolutely what I think the next step is for, let's say, this hospital, Rochester General. You want to take that cesarean rate down below 15%? Get the clients, get the patients involved, have them take ownership. Because when a woman is supported across all 7 pillars, her body is primed for physiological birth. Her nervous system is regulated. Her confidence is unshakable. She shows up to labor as the leader of her own birth, not a passive participant in a medical event. There's a big difference. So what would happen? C-section rates don't just drop. Birth trauma drops. Postpartum depression drops. Women step into motherhood from a place of strength and not depletion. So Leadership matters. If you're a coach and you're a practitioner listening to this and you have not taken the BirthFit coach course, we need you. We need you. Your community needs you. Rochester General didn't change overnight. It took leadership. It took physicians, it took midwives, it took administrators who all said yes to working together. Yes, we can do this together. We can be better together. And your community needs this from you. Your community needs leadership. Um, the BirthFit Coach course trains coaches and practitioners to be that leader, to show up in your community as the person who supports women across all 7 pillars, to be the coach to guide, the advocate who helps mothers trust her body, regulate her nervous system, and step into a sovereign mother-led birth. Y'all, if you know me, you know this is not about being anti-medical. This is about being pro-physiology, pro-woman, pro-choice. Not pro-choice, pro-trust. God bless. Y'all, I think I just revealed myself there. Pro-trust. Rochester General proved that when leadership aligns with what the female body needs, the system can change. Imagine what happens when every pregnant woman in your community has access to a BirthFit trained coach and or a BirthFit trained practitioner. Y'all, it's a ripple effect. And we could talk about abortion and pro-choice in a whole another episode. Actually, I did one in the past, and I'm not going to re-record this episode just because I had a slip up. But I think it was last year or 2 years ago. So if you want to dig into the archives, you can go listen to my thoughts on that. Anyways, the BirthFit Coach course is open for enrollment until January 31st. That's when we close the doors because live calls start February. If you miss it, get on the wait list for the next cohort. We have a cohort in the spring and a cohort in the fall. Y'all, I can't say this enough. We don't have enough BirthFit coaches. We don't have enough BirthFit practitioners. I get calls all the time. We need you. We need your leadership. Step up. Let's go. And be sure to leave us a review. I would really appreciate it. All right, y'all. Till next time. Peace.